Thank you. So I will speak about the preventive strategies for cardiovascular disease in adults with obesity, and I will try to answer the controversial question, is it possible to be obese and cardiometabolically healthy? So first, I will just tell you a word about metabolically healthy obese, and I will talk to you about the preventive strategies, mainly physical activity, fitness level, the effect of body fat distribution, and body weight loss. So there are a lot of medical complications related to obesity, and we'll speak today about the dyslipidemia, hypertension, and coronary heart disease, so the cardiovascular ones. So you have just to know that to be metabolically healthy obese, you have to have no comorbidities. This is a study that shows you that it has been studied, the Finnish patient, and they just studied and saw that the active obese men and women had less risk of mortality than, here you can see, than the lean inactive one. This is the man and the woman. And if you look at the cardiovascular mortality, it's the same. The obese active women has less risk of cardiovascular mortality than the lean active one. So the physical activity has a big effect on health. If you look at the cardiorespiratory fitness, it's another study. And you look at the BMI, it was on 43,000 people. On these 33,000 people, there were 13% obese based on BMI and 30% on body fat. So you see that using body fat is a better definition for obesity. You see also that on the 30 obese patient based on body fat, nearly half was metabolically healthy. So in conclusion of this study, they have a higher cardiorespiratory fitness, a low risk of cardiovascular mortality and morbidity, as well as total mortality. And what is interesting, there was no risk difference between normal body fat and normal BMI. So if we see now the effect of adipose tissue distribution, you have here the metabolically healthy. You see that it's located mainly in the subcutaneous tissue. Nothing in the liver, nothing in the muscles. So this one is not deleterious on the cardiovascular risk, whereas for the unhealthy, you see that mainly the adipose tissue is in the visceral fat. And this is really, it has another metabolism, and it's deleterious for the cardiovascular metabolic risk factors. It has also fat in the liver and in the muscles. So at a given total body fat, increased subcutaneous adipose tissue constitutes really a powerful protective factor. And if you have a low waist hip ratio, so you have a peer morphotype, so you will have a protective profile against cardiometabolic risk. So just to make a summary, the metabolic healthy obese, the prevalence is 10 to 40%, depending on the definition used. It does not depend only on body weight and body fat, and they show higher cardiorespiratory fitness level and less visceral fat and intrahepatic fat, and it's considered as a benign condition. They have a better prognosis and a decrease of 30 to 50% of cardiovascular morbidity and mortality, as well as total mortality. So in presence of comorbidity, to what extent weight loss can decrease them? So we have to recall that a 5 to 15% weight loss from initial weight is sufficient to lower dyslipidemia, lower hypertension, and decrease non-alcoholic steatosis hepatitis. Whereas congestive heart failure or cardiovascular events and mortality in patients with congestive heart, weight loss is not recommended. So we can induce weight loss by conservative treatment, so behavioral and lifestyle modification. So of course, through physical activity, and this is interesting, it gives you the dose-response effect between a level of physical activity from low to high, and its effect on the cardiorespiratory level, so benefits for health. And you see that if you start from very low physical activity, just a slight increase can already be benefit for your health. And if you perform 30 minutes 5 times a week, slight breathless mean per week, you see that you have really a great benefits for health. So no, it's not important to be really a high sportive person. Just a moderate physical activity is very beneficial. So here it's a pyramid of activity and inactivity, and it's important to counteract the inactivity, so screen, staying, sitting, by the daily physical activity in terms of duration. Move as much as possible. Then to have an effect on the cardiovascular risk factor, so it's aerobic exercise or light sport or walking, as we said, 5 times 30 minutes. And you can also make muscle exercise 2 to 3 times a week for the fat-free, for the muscles. So just a word on the nutrition. So we know that the Mediterranean diet, there's a number of studies, decrease the cardiovascular risk in primary and secondary prevention. So it's really vegetables, fruit, olive oils, omega-3 food, so fatty fish, nuts, fibers, all of the legume, garlic and onion. But also it's the eating behavior to be able to lose weight. So eating in mindfulness and mainly really feel the physiologic sensation of hunger and satiety. Eat when you're hungry and stop when you feel satiety. So the conclusion is that the principal goal of obesity treatment is to prevent the apparition of complications, so trying to keep the patient metabolically healthy, to prevent or to treat comorbidities. But we have to recall that a fit obese patient reduces by more than 3 times the risk of mortality, suggesting that improving the cardiorespiratory fitness, even without reduction in weight, might have an important long-term benefits. And then a patient with obesity who is fit tend to have a lower risk of CVD, cardiovascular disease mortality than a normal weight and fit patient. So it suggests that being thin per se is not sufficient to ensure an optimal cardiovascular health. Then really a 5 to 10% weight loss from initial weight is already sufficient to decrease comorbidity. And of course that the patient should understand clear the in terms of communication implementation of the medical advice to ensure a long-term adherence, which heavily depend upon motivation to change. Thank you.
Great. Thank you very much, Dr. Durrer. She's with us from the European Association for the Study of Obesity Center of Obesity Management in Lausanne, Switzerland. Thank you.